everyone. Are you one of the 400 million people in the world who has diabetes? Well, good news. Diabetes can be reversed with diet and lifestyle. We are going to discuss how diet plays a pivotal role in diabetes management. I am Amita from Nourish Talk, a platform for natural and holistic therapies. Presenting this topic, we have Apeksha Thakar, who is a clinical dietitian, certified diabetes educator, and Nutrigenomic Counselor. Welcome, Apeksha.
Welcome, Amita. Thank you so much. I owe this opportunity for Nourish Talk and to you, of course, to give me this opportunity to maybe the little contribution what I can make, in making people's life better. So this is it. I am going to touch upon my favorite topic, which is, diabetes. That's what my area of specialty is. And, to start with, what is diabetes? Diabetes, ultimately, we all know that, it raises your sugar levels, and, you are restricted to have few things, you have to probably go through the insulin shots and, uh, all things, half a knowledge, or maybe you call it as the way of living, whatever. So it is like, I am going to cover a lot of things on diabetes, about the diabetes management, about the foods, which can help you function better, and other stuff as well. So what is diabetes? Diabetes is a metabolic disorder. Okay, it's basically it's a core, and it is something where all other problems, all other ill healths are connected to this particular thing. Before I actually dive into the details of what exactly is diabetes, diabetes is not actually a disease. It's more like an endocrinological disorder, what we can call it as. So eventually, the bottom line would be that you have to manage, you have to ensure that you're managing your diabetes to make your life better, and to ensure that your physical and mental well-being is always at rest. Diabetes, because it's a metabolic disorder, there is a small problem where the body uses energy for its growth and development. So once you take any meal, okay, what is the next process which is expected? That your body enzymes, your insulin, which is a hormone, breaks down your food into the smaller absorbable particles of glucose for energy. So obviously the process itself is quite complex, but it is made more accessible to the cells. So now imagine if your insulin is not functioning properly, or you have some issues with insulin, then obviously your glucose metabolism is going to go for a toss. So to put it in simple words, your smaller units of sugar, which are responsible to give you energy for basic maintenance of body functions, is hampered. How would you correct it? Well, for cells, the cells only recognize one primary source of energy, which is glucose. And because you need good amount of food, a balanced meal, to ensure that your glucose is getting utilized by your cell and it is getting more permeable to your cells. So insulin is released in your bloodstream to accommodate sugar that is present in the blood. Okay, when I'm eating a meal, okay, the body hormones will respond to this, and insulin will get released in my bloodstream. Now in the normal scenario, there would be optimum discharge of insulin to make sure that my sugar levels are getting balanced. In case of deficiencies, obviously there would be heights, there would be spikes in the sugar levels, because my insulin is compromised, or maybe it's not that active the way it should be. So in diabetes, either there is a deficiency of insulin completely, and of course there is an insulin resistance, which is compatible to other factors as well, which we'll see in our next slides. Can I have the next slides, please?
Yeah.
Okay, so what are the type of diabetes? We know that around 477 million people on this globe, are having this issue. India being the diabetic capital of the world now. So it's very important to understand that what all kind of diabetes do we actually see. The most common form of diabetes, which has around 77% of the total population of the globe, has a non-insulin dependent diabetes, which is type 2 diabetes. Obviously, the second lead would be, you have insulin dependent diabetes, which is called as type 1 diabetes. You have gestational diabetes. Gestational diabetes majorly seen in pregnant females, when they are actually having a process of childbearing, and that's when they show insulin resistance, and which are potential candidates of developing type 2 diabetes mellitus. Rest 1% of the total population of diabetes are majorly, due to some immunological issues. So of course, they're very rarest form, but the most common, which is ruling the entire globe, is type 2 diabetes mellitus. Can we have the next slide?
So let's talk about the risk factors, I guess, right? That's what
Yes.
people want to know.
So, because it's a disorder, there are a lot of things which cannot be controlled, which are not in your hand. Of course, we are going to talk about modifiable and non-modifiable factors, which are involved in diabetes mellitus. But what are the risk factors? Now, honestly, if someone is asking me, even today, when my patients ask me, what is diabetes? What is the cause of diabetes? The major thing is, like, it's the most asymptomatic and a silent kind of disorder you have. In most cases, you might not show any classical signs, neither you can show any particular pinpointed factor, leading to diabetes. But there are some factors, which definitely trigger the development of diabetes in your body. First is genetic. Researchers have proven that, if you have a genetic predisposition of developing diabetes, you are always at the risk of developing type 2 diabetes, majorly due to genetics. Now, researchers have also shown that people who have their first or second generation of people, having diabetes mellitus, are at the risk of developing diabetes in their life sometime, by around 38 to 40%. So genetic plays a very important role, and obviously, as I mentioned earlier, that it's a non-modifiable factor. You cannot modify your genetics by any chance. So this is something where you would always be at the risk if your parents or your grandparents have it. Lifestyle, obesity, of course, it's a major modifiable factor. People who don't manage their weight, who don't lead a very good food habit pattern, or people who are sleep deprived, or they are more into the processed foods or alcohol intake, etc. These all are modifiable factors, and your diabetes management, trust me, revolves around how well you manage your diet. So this is something which is definitely on my list of modifiable factors, where the first most important treatment any healthcare provider would suggest is a lifestyle modification plan. So it's something which is modifiable and definitely has to be considered before giving any treatment or suggesting any treatment for diabetes mellitus. Stress cannot be seen. Everyone has it. The thing is that your hormones, and because I mentioned earlier that diabetes is an endocrinological factor, where you have a lot of issues related to stress. People with higher amount of stress without its proper management are shown to be prone developing diabetes in future. So it's very important to make sure that if you have stress, you need to manage it, and if you don't have stress, that's good for you. Lack of physical activity and other modifiable factor. People who don't ensure that they are at least contributing to around 150 minutes of total exercise regime per week are at a higher risk of developing diabetes, for the simple reason that insulin sensitivity is directly proportional to physical activity. If your insulin levels are up to the mark, you need to make sure that you need to complement uh, your physical activity. It can be anything, because exercise is something which works on your mental level as well. So there is no thumb rule as in what to follow in terms of exercise, but definitely it has a direct connection with your insulin sensitivity. People who are physically active or may just contribute to around 40 to 45 minutes of total any form of workouts per day are at a lesser risk of either developing insulin resistance or diabetes. Faulty food habits, which overlaps with lifestyle factors and obesity as well. We are going to discuss about the foods, which will help. But yes, faulty food habit is primarily one of the leading reasons of not being able to control your sugar levels up to the mark. So it's very important to understand that faulty food habits needs to be corrected. Most of the factors I am talking about today, risk factors which are responsible for development of diabetes, are modifiable factors. So definitely these all things can be converted to a healthy lifestyle and a healthy lifestyle management factors. And other metabolic issues, like PCOS, very common in females, and the primary reason of PCOS, sometimes females are more prone to insulin resistance. It leads to, of course, infertility and other issues as well. So other metabolic factors are also involved in the progression of diabetes mellitus in the body, especially metabolic issues like PCOS. Can we have the next slide,
Yeah.
please?
So, how do we know we have diabetes? The symptoms, I guess.
Well, the most common symptom, and this I was given, when I was studying, my tutor, my mentor used to tell me that, the most classical form of diabetes, and if you're looking for the symptom, the only symptom of diabetes in most cases is there is no symptom. It's a silent killer. Okay, it is something which messes up with your body hormones, your metabolism, and your other stuff. So in most cases you would not find any symptom because it's a disorder. It's very important to understand, people, that if you are having disorders like PCOS or hypertension or diabetes, they are not kind of diseases what you need to tackle. They are more form of disorders, so disorders are usually silent. They mess up with your body, without you being noticing. However, just to make sure that there are people who display classical symptoms of diabetes, first is blurred vision. Your sugar, uncontrolled sugar levels would definitely have a very negative impact on your retina. So your sugar, high levels of sugar, uncontrolled sugar would often lead to blood vision. You might also have episodes of dizziness if your sugar levels are just fluctuating, without a balance, without something, which is stable enough for your body to sustain. Frequent urination in nutrition, as we call it as, polyuria. So the urge of you urinating would definitely increase. So that could be one of the reason, so usually when you are getting yourself examined for diabetes, any healthcare provider would definitely ask for the prominent symptoms you are having. With diabetes, it is also noticed that every person has either no symptoms or some other symptoms, to make sure that the diabetes is getting detected. But frequent urination is one of the factor, and the prognosis where it can take towards diabetes. Increased thirst, which is definitely seen in people, they basically, there is a constant urge of drinking something, even if you drink, you are not able to quench your thirst. So definitely that is also a part of diabetes classical symptoms. Constant hunger, even if you eat your meals, you are not satiated, you are not satisfied after having a wholesome meal. So constant hunger is also, it can pinpoint towards the progression of something is wrong with your insulin resistance. It is also taken into consideration, because when you are planning a meal, if your insulin is not up to the mark, definitely you would have complaints of constant hunger even after having a full meal. So obviously you need to be very particular while pinpointing these symptoms, if it is asked by your educator or your healthcare providers. And numbness of limbs. There are people, in fact, many of my patients personally have this particular thing, where they face numbness of limbs, because the capillaries, the small cells which are responsible to distribute blood all over your body, they do get hampered because of the fluctuations in sugar levels. So numbness of limbs can also be considered as one of these symptoms. Apart from this, it's very important to understand that you might also have a feeling of lethargicness, dizziness. People don't feel like working. So definitely these all can be considered as a part of diabetic symptoms. Talking about the normal range, American Diabetic Association has also revised the guidelines, from a person who can be considered having a good control over normal sugar levels and pre-diabetic and diabetic. So anywhere around, fasting glucose level between 70 to 100, milligrams per deciliter is considered to be normal in the fasting phase. When I'm talking about fasting phase, it's definitely the fasting would be the first thing in the morning, where your blood sample is taken after around 10 to maybe 12 hours of fasting. So 70 to 100 milligrams per dl is considered to be normal in a person, who is non-diabetic. Pre-diabetic is a stage between normal and diabetic. So if a pre-diabetic person is not able to correct his lifestyle and other factors, would definitely be diabetic, 5 years down the line. So pre-diabetic is basically a midpoint, where it can either reverse you to normalcy or it can progress to diabetes. So anywhere around 101 to 125 milligrams per dl is considered to be pre-diabetic. Diabetes, anytime, if I want to detect any point in time, if my patient is having sugar levels, fasting sugar levels 126 milligrams per dl and beyond, that is definitely labeled, and it can be labeled as diabetic. So similarly with postprandial is basically 2 hours after I'm done with my meal, because your digestion process takes anywhere around 2 to 2.5 hours, to make sure that your sugar levels are just getting stabilized. And in case if you have some resistance with insulin, 140 to 200 milligrams is something which is a pre-diabetic range. Anywhere below 140 is like your normal, your insulin function is good. And anywhere which is beyond 200 is definitely termed as diabetic. So pre-diabetic category is also a form of diabetic category. So if I'm writing something on the prescription where my patients are into the category of pre-diabetic, they are known to be pre-diabetic, maybe the potential candidates for developing type 2 diabetes if they don't take it as a personal wake-up call. HbA1c, which is like very important marker, widely used. It does not need any fasting, and it is just one prick and you are done, you're sorted. Preferably it should be done on an empty stomach on a fasting level, early morning. But anywhere HbA1c ratio, where HbA1c is basically the iron, the molecule gets attached to the glucose molecule, and this is the most confirmatory, or one of the confirmatory tests done to make sure that diabetes is confirmed. So anywhere around, if you're doing good with the 5.6 to 5.7 range, is like absolutely normal. So it has a better glucose control. uh, you know uh, like your insulin is able to control your glucose better. Pre-diabetes is 5.6 to 6.2, and any value beyond 6.2 is considered to be diabetic. The best thing about HbA1c, because it gives you average for 3 monthly, so it's like a quarterly thing. So it gives you, and that is why this test is repeated after 3 months. What are the diagnostic tests? As I mentioned earlier, that HbA1c is one of the tests. Fasting sugar, postprandial, urine routine is also taken into consideration. I have not mentioned it here for the simple reason that not every healthcare provider uh, follows this protocol of just to make sure that there is detection of sugar or glucose in the urine sample or not. And in few cases, of course, CRP level stands for C-reactive protein. C-reactive protein is an inflammatory marker. So, which is done, at least I make sure that, I'm doing it for all my clients especially. For the simple reason, there are two reasons behind recommending CRP levels to be checked. Is with diabetes, inflammation in the body is quite obvious. So it's very obvious that there is some sort of inflammation, which this marker will particularly tell me that if I'm prone to more kind of infections, and it definitely leads to slightly elevated levels of CRP. Second and most important thing is diabetic uh, individuals are often prone to heart issues. They are at a higher risk of developing liver issues, blood pressure, heart ailments. So CRP marker is something, if from the start, if you're considering your CRP levels within the normal range, it is definitely going to help you to have a better lifestyle modification diet plan. Uh,
So, all right. So let's talk about the complications because I think you mentioned that earlier.
Yes. So, when your sugar levels are not, they are not up to the mark, they are not managed well. Long-standing complications of diabetes. All these complications, what you can see right in front of your eyes, are like long-standing complications of diabetes. In my previous slide, I did mention about that diabetes is a hub of developing other potential health issues. In fact, even today in our clinical practice, around 85 to 90% of people, walking into my clinic with the issue of diabetes have some or the other complications, related to it. So diabetes can never stay alone in your body, and that is why it becomes extremely important and critical to manage diabetes. It can never stay in your body, doing nothing. It needs a companion. So it will slowly and gradually start weakening your heart, your liver, your kidneys, your eyes, your bones, your nerves, etc. So obviously, complications of diabetes are categorized into two parts. One is micro, and second is microvascular and macrovascular. Micro involves, my retinopathy, what we call it as. So people with poor sugar control have glaucoma, which is clouding of retina. The vision is not clear. They have early cataracts. So again, it's very important to understand that diabetes, the crystals of sugar, do get deposited at your retina, and because of that, you face a lot of issues related to your eyes, which is called retinopathy. You have something which is called as neuropathy, because your body, from head to toe, is like, they have millions of nerves, coming, taking the blood, and they ensure that your body functions are not impaired by any chance. They get affected. Also, your kidneys to get affected, which is called nephropathy, which is another form of micro vascular complication of diabetes. Coming to macro vascular, obviously my cerebral, that is, chances of me getting strokes, chances of me getting or developing coronary artery diseases, heart attacks, myocardial infarctions, heart attack, cardiac arrest, are on a higher side. Uh, just to make sure that these all complications of diabetes are often associated with progression of uncontrolled sugars over the years. So for example, if someone is having diabetes, or it is a newly detected diabetes type 2, uh, and these all complications are majorly associated with type 2 diabetes. Type 1 diabetes is complete absence of insulin. So insulin management is done through insulin injections, insulin pumps, whereas type 2, so these all complications are associated with type 2, which is the most common ruling form of diabetes worldwide. So, these all things are like associated with poor functions of nerves, poor functions of liver, poor functions of kidneys. My heart is getting affected, my brain, because, everything is connected to these all things. When I am not able to manage my sugar levels, up to the mark, obviously this is going to lead me somewhere in future with the complications as mentioned, on the slide. So it's very important to understand that, everything boils down to one thing, which is good level of sugar. Your sugar levels have to be managed in a way where you are leading a very healthy and a normal life, without any complications. Obviously, one of the complication and a major complication is like, poor wound healing, and it leads to diabetic foot basically. So because there's a loss of sensation, especially in diabetic individuals, so they don't feel anything in the low proximity, and that is why you would have heard people saying that you need to take care of your foot if you're diabetic. So obviously this happens only when your sugar levels are just creating havoc and they are way out of the range, for you to being able to manage it well. So diabetic foot is the most common form of complication. In fact, one of the protocols of us, giving a diabetes management program to anyone also involves a good foot care routine, for the simple reason that such people having history of diabetes from past 25 years or maybe 30 years would sometime somewhere in their life would have some issues related to their nerve, and neuropathy, which is going to come. But we have to ensure that we are just delaying the progression of these complications. And individuals who are able to manage their sugar levels well would definitely be very healthy, and they would definitely not land up in some serious complications of diabetes, as I mentioned earlier. Can we have
All
the next
right.
slide?
So let's talk about management of diet, keeping that in mind, time in mind.
Yes.
How do we manage now through diet?
So, managing diet, any part of diet management involves something which is called as medical nutritional therapy. People who are pre-diabetic might not need any kind of oral hypoglycemic agents or, GLP inhibitors, just to make sure that, their diabetes is managed. But that does not mean that, they can eat whatever they want to. Your entire thing of lifestyle modifications and obesity factors and weight management factors revolves around 80% of your body, and your disease is managed the way you eat. So obviously, to begin with, how would I manage diabetes, for anyone? Just to put it plain and simple, I would incorporate complex carbohydrates. Diabetic people especially are really frightened, when we talk about carbohydrates, because anything which has excess of carbohydrate, my body is going to produce more glucose, and if there is insufficiency of insulin, obviously my sugar levels are going to go up, because the hormone, the security guard of my body is not functioning properly. So obviously it is going to end up in trouble ultimately. So complex carbohydrates are present in whole grains. Cereals are very good form of complex carbohydrates. And obviously we are going to encourage the use of low to moderate glycemic index foods, which I'm going to talk about in my later slide. But you need to encourage a more amount of foods. So for my patients, I just have a simple tagline where I say that eat from the earth, not from the boxes. The moment I'm picking up anything, which has a processed thing, obviously the complex carbohydrate content is going to go low. So pick up, make some wise choices. It's not about what you need to restrict, or not. It's about eating in balance and making sure that you're making right choices to manage your disorder better. High biological value protein, I would definitely say yes, a big thumbs up to high biological proteins. Proteins are basically building blocks of body, and they're very important for growth, development, wear and tear, and also to a very larger extent they are responsible for the proper efficient functioning of insulin. So high biological proteins might be dairy products, low fat dairy products. You have pulses, you have eggs, you have chicken, you have fish, lean meats. These all are categorized as a good amount of protein content food. So make sure that you are saying yes to them, and you're taking in portions for sure. Fiber rich food, around 25 to 30 milligrams of fiber is grams of fiber is important for the basic management. In fiber rich foods increase the insulin sensitivity in the body. They help in weight management because the feeling of satiety is always on a higher side if proteins and fiber are clubbed together in a meal. So it's very important to understand that fiber rich foods have to be included, and that is why I would still stick to the fact that the more processed products you take, the more you are sacrificing on the fiber content on it. Simple examples of fiber rich foods are like vegetables, fruits. They all have very good amount of fiber content. Whole grains are also a part of fiber content rich food, so make sure that you are saying yes to them, and you are just making sure that they are part of your wellness chart. Vitamins, very important. You have B vitamins, you have fat soluble, water soluble vitamins like B and C. You have fat soluble vitamins like A, B, E, K. All of them are abundantly available in your fruits, vegetables, and other products. So make sure that your vitamin content is definitely on a higher side, because in most cases we have seen that people who are on diabetic drugs are often low on their vitamin things. So when we take their blood samples, or when we ask for the blood screening, we have noticed that their vitamin levels are often on a lower side. Minerals are also very important for the management of diabetes. So basically, in and all, if I just want to put it up in one simple word, it has to be a balanced meal. So nothing more, nothing less. It just has to be personalized and customized based on your requirement. Water, 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 very important nutrient. Water is a universal solvent. It is responsible to transport various nutrients to various parts of the body. They help in weight management. They make your GI system more clear. They are universal solvents. So water is very important. I consider water as a very critical and important nutrient for diabetic management diet chart, for sure. Low sodium intake, very important. Sodium is basically salt. Okay, salt is something which is a white poison, and the more processed products I take, the more ready to eat packages I eat and entertain in my lifestyle, they are definitely going to not only affect my heart, but they are also going to make my diabetes management worse. So you need to make sure that your salt intake is like just bare. It is kept to just normal. In case if you're not hypertensive, but you have to make sure that you are not encouraging any external source of sodium in form of chips, or packet products or biscuits or cookies. Just to make sure that your low sodium intake will definitely help you for the better management of diabetes.
So, what should be a typical diet plate then?
And this is how a diet plate looks like. We have those diet tools in our clinic where we show people, our patients, our potential diabetic patients, to make sure that this is how it goes. And it should actually look like a CD. A CD, what you use, it should be around 9 inches plate. And this is how you need to place your meal. So if you notice this, half of my 9 inch plate is filled with fruits, vegetables. So definitely around 50% of your total calorie intake should be encouraged, from fruits, vegetables, to make sure that I am able to give vitamins, minerals, fiber, everything from that. If I want to go to the second half of the plate, second half, the 1/4 side would be cereals. So basically, it has to be loaded with carbohydrate, good carbohydrates. There are two types of carbohydrates: simple, complex. Go for complex. It's a no-brainer. You need to go for complex carbohydrates. Just fill in your stomach, and you should do good with diabetes. This is very important part. We need to understand, all the diabetics need to make sure that your plate should look something like this, just to make sure that your diabetes is not giving you any troubles with sugar management. Carbohydrate meals, of course, 1/4 of my plate goes to carbohydrate, which is very important. It's a primary fuel of energy. Even diabetics have to eat good amount of carbohydrates in portions suitable to their body for the better management. Carbohydrates are very important for your body. They are extremely important because they're the primary source of fuel, what your what your body uses for energy. So please do not eliminate carbohydrate thinking that it's bad for diabetes, but it's very important that you what kind of carbohydrates you take and how much do you take. That really matters. And rest one fourth is proteins. I mentioned earlier that proteins are extremely critical for wear and tear of your cells and for the better functioning of insulin. So obviously you need to fill up your plate with good amount of lean proteins, high biological proteins like eggs. You have tofu, you have soy, you have non-veg sources. You have dairy products which are low fat. So this is how an ideal diabetic plate looks like. If you're able to manage this, you are sorted. Coming back to glycemic index, as I mentioned earlier, that complex carbohydrates. I am sure that once you're detected with diabetes, and you are going to any registered dietitian or or clinical expert, diet expert, would definitely give you this list to just ensure that you are making wise choices with your foods. It's very important to understand that your glycemic index is basically the capacity of that particular food to increase your sugar levels. How well they can increase your sugar levels after they are ingested by your body. So high glycemic foods are something which you need to stay away. It's like it looks more like a red signal where you can just take them as an occasional treat, because they will simply bring about that insulin spike in your body, and definitely they would mess up with your sugar levels. So treat high glycemic foods as occasional treats. These are the list of high glycemic foods which are something you need to make sure that that you're just slowing down with them. And anywhere the glycemic index above 70 is considered to be not so good or diabetic friendly. Medium glycemic index foods are something which you can take them, and your dietitian would actually keep into consideration your low and medium glycemic index food to chalk out a personalized nutrition chart for you. So medium glycemic index foods, anywhere around 55 to 70, ranging their glycemic index, would definitely be, and they should be the part of your diabetic diet plan. And low glycemic index are something which you can use it freely. You don't need to bother about your sugar levels because they hardly contribute to any kind of glycemic or spiking of your insulin levels. Your sugar levels are something which are largely dependent on what you eat. It's not about elimination. You can also do very well by incorporating high glycemic index food, but it's always better. It's like a traffic signal where you're saying that red is like stop, green go ahead, and orange is like slow down. So just remember this chart, and it is something which would be of for your reference to make smarter and wiser choices to manage your sugar levels better.
All right. So what do we say no to? I think you already talked about a lot.
Yes. I would definitely insist a lot on things with any kind of diabetes. If you really want to make your lifestyle changes to be sustainable, I would say go slow, make healthy choices, and strike a balance somewhere. So when I'm saying no to them, it's something where you don't, if you can curtail them completely, great. If you cannot curtail them completely in your diet, alcohol is something which is like gives you empty calories. Okay, it is not very body friendly for any body functions. In fact, most of the type 2 diabetes patients, especially, they need to lose weight, so they have a lot of insulin resistance. And because it's an empty calorie is nothing, it does not give me any nutritional benefit. So I am not, my body is not benefiting from it, if, even after its consumption. So alcohol, 1 gram of alcohol gives me around 7 kilocalories, and that is something where it's a waste. It's like satisfying to my mind maybe, because but it's not helping my body or manage my sugar levels better. So definitely alcohol is something which has to be curtailed. If at all you need to consume alcohol, you need to make sure that you are not going beyond one drink. for females especially, and will be on 2 drinks for males. But alcohol in any case, it's a wise choice to just eliminate them and put them under red zone. uh, Sweet and refined products, yes, very important. I mentioned in my earlier slides that I have spoken about a lot of refined products and processed products. Sweets, obviously, for simple reasons that they will definitely bring about sugar spikes, and they just come crashing down anytime, so they make you feel good and there is a huge surge later. So it's very important to curtail them, make them as occasional treats. You can use some sweet substitutes, which are better choices, but you need to make sure that you're not staying away from such high sugary stuff. Red meats, yes, you need to eliminate red meats also, for the obvious reason they also hamper your cholesterol level, especially LDL cholesterol, which is a low density lipoprotein. It's a bad cholesterol. It's called bad cholesterol, and most of the diabetics have dyslipidemia. Basically, their lipid profile is also messed up completely. So it's better. Sodium, I have already spoken about sodium rich things. Sodium basically, it is not only good for your heart, but overall for diabetes management, it slows down the progression and the better management of diabetes. So it's better that you are definitely not taking sodium rich foods. You're eliminating them. Please check the nutrition label, before you actually take any choices, because 1 gram of salt gives you around 2300 milligrams of sodium. So please, information on the nutrition label is extremely important. Caffeine are something where you get it in tea, coffee. Okay, caffeine is not very bad, but yes, it is. I can categorize caffeine within the limits. So you need to make sure that if you're including caffeine, which is in form of tea or coffee, I would say at the next 2 to 3 cups, because around 1 cup of coffee gives you conveniently around 90 to 100 milligrams of caffeine. So technically 300 milligrams of caffeine, that's it, per day consumption is the maximum limit I can set in. Caffeine, it's best, if you're not so addicted to coffee or tea, it's best to eliminate them, because they are also diuretics. So they interfere with the absorption of your diabetic medicines as well. Heavy meals, thumb rule of any diabetic, because I want to prevent insulin, your sugars, surges, I have to ensure that I am giving in portions. If you develop into a pattern of eating 5 6 meal pattern per day, where you're breaking your calories into small units, it is definitely a very effective treatment to manage your diabetes better. Heavy meals give a lot of competition to your poor insulin resistance, where it is already struggling with its basic function. So it is definitely very taxing on your digestive system, which takes around 80% of your total energy. And it's not a very good idea to make, sure that you are feeding your body with a larger meal portions, because that is something which is not good for your sugar levels. It's not good for your digestion too. And diabetics often have some GI related issues, especially with digestion. So it's very important to consider that you're breaking your meals, under the supervision of a diet expert, to make sure that your sugar level are constant, and of course your glucose levels are also steady throughout. And fried stuff, not to say, because as I mentioned earlier, that once the diabetes enter your body, it definitely gives you a lot of complications with your heart and your cholesterol profile and your lipid profiles and your kidney profiles. So fried foods, of course, you need to just go slow on them, and obviously fried stuff will make your meals heavy. At the same time, they will contribute to extra uh, calories what your body does not need. One of the principles of managing diabetes well is a calorie deficit diet, especially for obese individuals. As I mentioned earlier, that they are into the category of losing some fat, around 10 to 20% of their body weight is excess than the normal ideal body weight. So fried stuff would anyways not help. Definitely all these things can be taken as an occasional treat, but you have to kind of remember that they are not going to help you in any ways. They might mentally be very fulfilling, but physically they are of no use to your body.
All right, so let's quickly talk about functional foods. We are only 10 minutes away from the hour.
So functional foods are basically foods, which help in, they have a specific component, which help in a better insulin response. So, these things are abundantly available. They are locally available as well. So, the functionality of these things is they have a specific active components in them, which help and which have a very positive impact on your insulin levels. When you want to probably increase the insulin sensitivity, which you want, any diabetic would want to increase insulin sensitivity. These all things have to be a part of your diet. Fenugreek seeds, excellent source of beta glucan, which helps, which has a very positive impact on your cholesterol levels. They have a fantastic response on your diabetic control, especially your fasting sugar levels. So definitely fenugreek seeds have to be a part of any. You can also use some fenugreek powders. You can encourage some soak seeds, soak them overnight and consume them next morning. But yes, please make sure that they are the part of these things. Functional foods, no food in isolation can actually, I can't pinpoint on one particular thing, which will help you to manage your sugar levels steady. But these all things combinedly with a lifestyle modification plan works wonder. Turmeric, again, curcumin in turmeric helps in increasing the insulin response. So please include, and it's very popularly used in Indian cuisine. So, turmeric is something which you need to use it. Cinnamon, again, one kind of functional food, which really helps, in bringing your sugar levels down and also improving your lipid profile. Soya, isoflavones in soya and its products. You can go for some pre-harvested soya. You can go for some bean curd, which is called tofu. You can go for roasted soybeans as a part of it. Tomatoes has a very powerful antioxidant lycopene, which helps in proper management of it, and also it's considered to be a low GI food. So it's a big yes for tomatoes should be a part of a diabetic meal plan. Probiotics, when I say probiotics, are basically fermented products. You have curd, you have fermented products, you have kefir. These all are wonderful probiotics. Why probiotic is functional food and helps in better insulin response is insulin sensitivity is increased because your most of the diabetic, as I mentioned earlier, are having some sort of GI issues. This keeps your gut healthy. It's an irony that most of the problems, the occurrence of most of the health issues is from your gut, poor gut health. So probiotics helps to fix that, and thus in exchange it also increases insulin sensitivity. And fiber, as I mentioned earlier, helps in weight management, makes your sugar levels more steady in your body. At the same time, it also helps in cholesterol management.
So let's quickly go through some of the tips that you will tell our viewers.
So the first thing is definitely, there is a myth that diabetics cannot eat fruits, because it has sugar. Every fruit has sugar, fructose. Basically, it's called fruit sugar. Or however, that's not true. The wonderful dosage of vitamins and minerals what your body desperately needs to manage your sugar levels better is obtained from fruits. Major chunk of it is obtained from fruits. Obviously, you need to curtail fruit juices because they are sweetened. You need to add some extra table sugar to it, or maybe you just strain them. So important fibers are anyways lost. So obviously, you don't need to encourage usage of fruit juices, but fruits can be taken definitely in portions. The every food you eat has an impact on your sugar levels except water. So obviously your healthcare provider is the best person to help you out with this. You need to have balanced diet, as you can just correlate it with your diabetic plate. You need to have fibrous fruits and vegetables. By now we know that why fiber is so important. Protein rich meals are very important. You need to go slow on your junk food and ready to eat processed products. Take them as occasional treat, just to make sure that your junk food consumption is to bare minimum. Dinner should be around 3 hours before bedtime. It's very important to maintain timings. With diabetes, there are three principles: portion control, timings, and most importantly, the spacing of the meals. If you are able to get all three factors in your meal chart, you are sorted with your diabetic plan. Exercising, as I mentioned earlier, 150 minutes per week is very important. Any form of physical activity is important, at least 5 times a week. Regular foot care, in India here, it's a part of diabetes management. Foot, because diabetic patients have a very sensitive foot, so you have to take care of their diabetes. You need to take a screening for foot care at least annually, just to make sure that everything is like okay. Especially when you have diabetes detected 5 years before, so you need to make sure retina scans and fundus examination, because obviously microvascular complication or is retinopathy, and your eyes are really affected because of uncontrolled sugar levels. So foot care, retina scans, are very important part of a medical protocol, and they should be taken annually.
Okay, so we are actually on the time very quickly. We'll have to wrap up very quickly in a
So
few
it's
minutes.
like a diabetic sample menu. This is how a diabetic sample menu looks like. Okay, very important to understand that these all things are like one size does not fit all. So it's just a gist of what exactly, and this is how a diabetic sample menu looks like. Obviously, the quantity, the calorie consumption is really dependent, and it's highly tailor made based on your individual requirements, and one size does not fit all. So this is something where you need to make sure that it's just perfect for you, for your management. And quickly with the case study, obviously I would like to conclude with the case study. I have the patient, Mr. Rao. He was newly detected diabetes from past 2 years, but his fasting levels were normal. His post lunch levels were really high, and it's very common complaint. How did I help him? Post diabetes, obviously, Mr. Rao used to have only cereals for his breakfast, okay, which are carbohydrate, and carbohydrate in turn increases your sugar levels. So, I suggested him to club protein and fiber, as I mentioned that they increase the insulin sensitivity as well. So I suggested him to make sure that your breakfast is like cereals, proteins, and fiber, all three in combination. After 2 weeks, of course, by making the dietary changes, and working around his breakfast, obviously we showed a remarkable improvement in his post-lunch sugar levels. Because what he was eating for his breakfast and then going for his post-lunch diagnosis, obviously just because of eating sole sugar, cereals definitely had a very negative impact on his post-lunch sugar levels as well. So this was sorted. It's very important that you need to make sure that you need to correct these things in your diet, and it's a very common thing to happen. Case study two, I have a patient called Shabnam, obviously type 2 diabetic, 7-year-old diabetic. She was detected with nephropathy. Nephropathy is a complication of diabetes, as we discussed earlier, and her creatinine levels were high. So basically, nephropathy is connected to the complication of kidneys, and creatinine is one of the factor, which is because of the muscle activity what your body takes place. So your muscle, activity produces creatine, and in return it goes to kidneys to form creatinine, and they are excreted. Obviously, her because of her creatinine levels increased by 2.5 milligrams. She stopped eating all the milk products, so basically all the protein eliminated. She started on her own eliminating all the proteins, and this is what was the result. When she came to me, she had lost a lot of muscles, because your body needs proteins to develop and maintain muscles. And because she restricted all proteins, that led to muscle loss, and obviously her creatinine levels went high, because there was a lot of muscle activity which broke down creatine to creatinine. I ensured that 50% of her diet was biological, high biological value protein, so around, I included restricted amount of protein, but I gave her good quality of protein, around zero point 0.6 to zero point 0.8 grams per kg body weight. What was the result? The result was, her muscle toning started improving in 3 weeks, and her creatinine levels also improved. Creatinine levels are basically marked with something your body does not need. So it's not important that you need to eliminate one factor like carbohydrate, or you need to exclude one thing. No, it's like a team effort, where everything counts, everything, every single nutrient counts. It's just about portion. It's just about eating right for the kind of problem you have and the kind of body you're looking for.
So thank you so much for giving a very valuable and informational webinar today. I don't know what happened to the slide, but please let us know who is listening. Your feedback. Apeksha would be back. We will be having some more classes that she can teach how to manage your diabetes in a group therapy. That would happen in August. We are short of time right now, but please let us know your feedback on our email or on our FB or anywhere that you can reach us. Thank you so much, Apeksha, for being with us today. I think I have a question real quick. Let me just see. Well, I was diagnosed diabetic in 2011, but there is an increase in my weight. How can I reduce? So quickly, I think if you could talk about that.
So it's about, obviously, because you are having the existing issue of insulin resistance, losing around 10 to 20% of your fat, would definitely help you. Now, there are a lot of calculations, related to this. First you need to get your blood work done. Secondly, you need to ensure that, how much do you need to lose? How many pounds are you overweight? So obviously you need to make sure that you are starting one by one. You're not messing up your body with all the things, what you need to change in one go. That's not going to happen. Take it as a journey, not as a destination. So how can you start this? Make sure that how many pounds do you need to lose. If you're taking any medicines, seek a help of a healthcare provider or dietitian who can help you with a better medical nutrition therapy. And it will also ensure that, your diabetes is getting controlled. So few things, what I have mentioned already in the slide, you can take them as well. But obviously you need a personalized nutrition, just to ensure that, you're taking into consideration all other lifestyle factors as well.
Yeah, thank you. So, Apeksha, if you have any questions, you can consult with Apeksha. We can send you all the information after the webinar. Someone is asking us, would you make available the streaming of the webinar? Absolutely, yes. We are streaming it right now live on FB, and after this, we will be posting it on FB as well as in our YouTube, as well as on our website. And Apeksha, like I said, she is very well trained and she has a lot of experience managing diabetes for a lot of patients. And she will come back to give more group therapy sessions, which we will be announcing it soon. So I think I will like to wrap up. Anything else, Apeksha, that you would like to say?
Thank you so much for giving this opportunity. Maybe the little bit of difference what I can make to someone's life would really count. Remember that you need to know the difference between the disorder and disease. So all the viewers who are watching me definitely need to understand that it is not something you need to get scared of. It's just that if you just revolve around your lifestyle factors, especially the modifiable lifestyle factors, what I mentioned about in my presentations, this will really help you to lead a normal life, which is absolutely healthy and without any complications. So
I
please
think
share
it
me with
was
me.
As an excellent presentation. I hope our viewers felt the same way. I think it was very detailed. I'm not diabetic, but I could sense, walk through the whole system, the whole process, the way you walked everyone through. So it was really good. Thank you so much for being with us. Hope everyone really found the information very useful. Please give us the feedback. Signing off now. Thank you so much.
Thank you. Thank you.
Bye-bye.
Bye.